Hey everybody, welcome to the Big Huntsville Podcast, the show that's all about the people, places, and the stories that make this city an amazing place. I'm your host, Carl Thomas, your favorite realtor, singer-songwriter, and all-around Huntsville cheerleader. Each week, we'll be shining a light on the community heroes who make this city tick, having some fun along the way, and sharing a few real estate tips when you least expect it. So whether you've lived in Huntsville your whole life or you're just thinking about calling Huntsville your new home, you're in the right place. Let's get started. Welcome back to Big Huntsville Podcast, where we selectively choose people who are doing big things in Huntsville and in our area, North Alabama, Southern Tennessee. And we are very excited today because we have a really awesome person on the show with us who is very qualified to be on this show, so much so that I am as nervous as I can be. But today we have Dr. Tiffany Schwasinger-Schmidt, MD. She is a key figure in North Alabama's healthcare evolution as a faculty member at UAB Heersink School of Medicine's Huntsville Regional Medical Campus. Wow, that was hard to say. She mentors medical students and residents, expanding access to internal medicine through training. Her work ensures Huntsville's healthcare system keeps up with our city's growth, which is huge. If you know that Huntsville, if you've been here a while, you realize that most of our residents are super smart and really well put together people. A lot of them are engineers, and they expect very high levels when it comes to healthcare. A lot of these people are choosing to retire here. Even if they move to another area, they'll come back to Huntsville. Even though Huntsville might not be where they were born, they will return to Huntsville and retire here. And a lot of that has to do with our medical opportunities, but our hospitals, our healthcare here is wonderful. And Dr. Tiffany is part of the reason for that. So thank you so much for being on the show. I really appreciate you being here and hanging out with us. How are you today?
I'm wonderful. Thank you for the opportunity to come and talk about the great things that we're doing at UAB and how we're really here to help support the community in advanced medical care right here in Huntsville.
So before the show started, I had mentioned to you that I passed your building a million times, and I had to make sure that was the right place, because if you're not training in the medical field, which if Carl Thomas, he is not training in the medical field, you may not even notice it, but it's on Governor's Drive across from Huntsville Hospital. Sits on a really big spot there, big brick building. That is the UAB. They have a campus here in Huntsville. And UAB, that has to do with Birmingham, right?
Absolutely. So we're a regional campus off of the Birmingham campus, and we're really designed to be able to produce doctors and to produce people that are training to serve Northern Alabama. And so it's an incredible opportunity for our learners, both our resident physicians as well as our medical students, to work within the community. And we know that by having students train in the community, they're more likely to stay in that community over time.
Sure.
And one of the other great things, as you mentioned, this is an incredible city with so many highly educated people. And one of the opportunities that we're looking for is really expanding clinical research and ways that we can advance medicine right here in this community. So you're not having to travel to Birmingham or to Vanderbilt or to some of the other areas here. It really breaks down those travel barriers for patients that are interested in participating in helping develop these new medications, new treatments, new devices, so we really can get people better health care.
And that's very important here. Like I said, there is a high standard in everything. I'm in real estate. I see it on the building side. When a builder builds a house in Huntsville, they cannot cut corners because the buying population is so educated. They may have never built a house, but by the time they get into a contract with a builder, they know almost as much as the builder does. So they can't have a builder cutting corners because they'll catch it. So builders have to live at a high standard. So same in the medical field, I'm sure, which another cool thing about having UAB here, having people like you here to train, is that the fact that you got these families that have moved here who have high level jobs in maybe engineering, things like that. And then their kids have somewhere local that they can go to school and learn what they need to learn so they can stay here. It's just really rare to meet a native of Huntsville. So you've got these kids who grew up smart just like their parents, and there's an opportunity here to do their medical training in their own city, which is awesome. And which that's one of those things is that like in the music area of Huntsville is 2 hours south of Nashville, where music is huge. But if a musician wants to make it big, they have to leave Huntsville to do that. I always love when I hear that there are opportunities for those people with talent to stay here and learn here and succeed here in Huntsville. It's a very neat thing when you hear that somebody actually grew up here and stayed here. It's a rare thing. It becomes more and more rare every day to meet a native. So I think that's something cool that you're doing is you're keeping natives native. So that's
Absolutely.
awesome. So tell me a little bit more about what you guys do there. Like talking to someone ignorant like me, what happens in that building?
So what we're doing here is really training our physicians, but also teaching them about research and how medications are developed, because there's a whole process as to how medications go from an idea to actually being able to be prescribed by physicians. And I think that's a key part of educational training for doctors, because we need to know, is this medicine going to work in this individual for the problem they're experiencing? And
Sure.
so I think it's important that we integrate that education from our medical students to our residents to including our faculty now who are also doing some of these studies to help them understand that process. And one thing that the community is so valuable for us is we don't know if these medications work in everybody's body unless we test it in everybody's body. So
Right.
we want people to be engaged. We want people from all backgrounds, all medical histories, whether you're healthy or whether you have a condition, to be a part of these trials, because it helps us understand as physicians how these medications work in so many different populations so that we can give patients the best advice for their health care to make them as healthy as possible so they can do all the incredible things that they're doing.
Sure. So there's opportunities for others, folks like me, to get involved and actually help people through your research.
Absolutely. There are so many different opportunities that we have when we're looking at developing new medications, developing devices, and even just understanding disease. It's really important for us to understand how disease develops, how it works in the body, so we can look towards those treatments and those cures for individuals. So
Yeah.
healthy individuals, we love people that can come and participate in some of our studies so we can understand more about the human body and how it works.
Okay. All right. So tell me this, is there anything unique about UAB or North Alabama's medical education approach, how you guys do things?
You know, it's really focused on the community that we're serving here and understanding the population of Northern Alabama and what the needs are. And I think that's really important because as a physician, I just came from the University of Kansas where I spent 8 years in practice. And I really understand that community because that was where I grew up. And coming to Alabama, it's a very different community. And so I think it's really important to understand what the community's needs are so that we
Sure.
can best fill them. And as we're producing these doctors that are wanting to stay here in the region, we need them to understand what the needs are of the community and again, how we can best serve the community moving forward. And I
Right.
think that's what UAB, specifically UAB in Huntsville, is so talented at doing because we are a part of the community. We want to be out there. We want to be meeting people. We want to be taking care of people. We want people to know that we're here and the work that we're doing so that we can make a difference and we can help.
That's awesome. That's awesome. So do you feel like there's a gap in local physician availability here? Like, what do you see happening? Because you're in that circle where someone like me who's just driving by a red building, we're not. So tell me, are we needing more?
Absolutely.
Okay.
As you mentioned, the population here in Huntsville is growing exponentially. There are so many people that are coming in for the opportunities that are offered here in the city, which are very unique when you look across the country. And what we can see is there's just not enough doctors to be able to serve the population's needs. I've been here for about a month and already my practice is filling up very quickly. So that tells
Wow.
me that there is a need for more physicians here to be able to take care of people. And so that's, I think, the niche that we fill is really knowing that the population is expanding so quickly. So we need to provide those services and expand the amount of available physicians so that way
Sure.
we can take care of people.
Yeah, absolutely. So we had Dennis Madsen on the show not long ago. He's over or involved in urban development for the city of Huntsville, and he let us know that 7 people a day are moving to this area, and it's the general area. Some of these people are relocating 45 minutes from Huntsville, but their reason is to drive into our area every day to work. So I absolutely believe that's a correct statement that it's hard to keep up with the roads. If you've noticed, everywhere you go, there's road work happening. I've got to really pay attention. I'm going to hit one of those orange cones at some point. I know it's coming. I'm going to drag it with me. But there's just so much expansion happening here that someone like me who doesn't even think about that won't may not realize that for our healthcare, it's important that continued education, continued opportunities come in Huntsville, and that there's someone like you focused on filling those positions that are needed too, and training those people, giving them the type of training that they can handle the scrutiny that our smart residents are going to give them. So that's amazing. So, what do you see the future of healthcare in Huntsville for the next 5 to 10 years?
So I think it's going to continue to grow and expand. And what I'm really excited about is understanding what the needs are here. Because every place that you move in the country, the needs are different. There are different common conditions that can occur among people within a population. So understanding what those are here and making sure that we're meeting that need and we're growing appropriately with our community. I think that's probably the key point that we're looking for as we're looking at educating our doctors, are truly what are the needs. And when I do research and work with the team here, that's something that's a huge priority of mine, is getting out in the community, meeting people, understanding what their healthcare needs are. Where are the gaps? Where are the things that people have tried different medications and they haven't worked, or their condition is one that not a lot of people understand? How do we really fulfill that need, and making sure that we're bringing that research here? So again, people are not needing to travel long distances
Yeah.
to have the opportunity to get that treatment that they really need.
Sure. And that research is vital. It's vital to when we have a health scare, that there's some medicine that will get us through that quickly and safely, and we can move on with life. So let's focus in at the end of this show on those clinical trials. So tell me, what can you share that will help people know how to get involved in that and what's involved in that? I guess that's what can you promote that will help us laymen out here in the community who are driving by the red brick building know how to get involved?
Well, I think clinical trials are really for everyone. And one of our big focuses that we've had here in Huntsville is especially surrounding mental health, because there is such a challenge of people getting access to mental health care these days. And unfortunately, some of the medications that we have just are not effective for certain people. So that's been a big focus of ours, is working and treating in mental health conditions. So anything from depression to bipolar disorder, suicide prevention. And one of our main focuses is not just that we have the research here, but also that we connect people to care. I think it's sometimes very hard for people to be able to find a doctor, and especially when they're in crisis. And so that's a service that we really focus on offering, is if someone comes to us that they're interested in research, and we may or may not have a study for them, but making sure that they get the care that they need,
Yeah.
making sure that we connect them with our physicians, or if more appropriate, physicians in the community, to make sure that they're getting the care that they need.
Yeah.
And clinical trials are so critically important. And I'm always so grateful to everyone that participates, because to me, they are the true heroes. You're doing this not because you have to, but
Right.
because you want to help others. I always ask clinical trials participants why they do this, because I think it's very fascinating. And time again, I always get the answer: I don't want my children to suffer with this. I
Sure.
don't want my neighbor to have to struggle like I've seen them struggle. I want to help. And whether or not it benefits them or not, because we never know whether they actually get the medication or a placebo, because it helps us really, by doing that, understand how the medication's working and if it's working. But truly, to be able to, if this medication is safe and effective, we want to get it to the FDA, we want to get it approved, we want to get it in the hands of the people that need it the most. And
Yeah.
everybody that participates and helps us take those steps towards getting that better treatment out there, truly, in my eyes, is a hero. They're the true definition of it, because they're helping us understand, they're helping us advance care, and they are helping millions of people in the future live better, healthier lives.
Yeah, and you could be a part of a miracle drug. I know that we're seeing the effects of a couple miracle drugs right now, the Manjaro, the Zepbound, Govi. All of those medicines have caused all these people to be skinny. And it's crazy because the medications change your brain patterns. It changes how you feel about eating. It's a really wild thing that's happening right now. And that medication came from someone volunteering to test it, to be a part of that. And I know I'm on the very surface level end of what I'm talking about because we're talking bigger issues, cancer, things that are deadly that you guys are finding cures to, which is amazing. But living life with purpose sometimes is doing simple things like volunteering to be a part of a medical study. I'm telling you, we are naturally selfish in our thought patterns. I don't have anybody else's thoughts in my head but my own. But if you want to feel purpose in life, doing things like this will give you that purpose because you are helping someone down the road. It's a thing that you can do to step outside that selfish self and do something for someone else. And you probably will never meet that person you help, but it can be an incredible change to your life by giving you more to live for. And that's an awesome thing. So how do people find these medical trials? How do they volunteer?
So we actually have a great resource of the trials that we're having. So we have a website and we'll provide that link for everybody who's interested to kind of show the different trials that we have at this time. And again, even how healthy people can volunteer. But more importantly, if we don't have a trial at that particular time and you're needing medical care, we can get you connected there. But also, our trials change every day. So we always like to, if people are interested in volunteering, to collect your information. So when that next opportunity comes up, we can reach out and make sure we're connecting with you.
Yeah, that's awesome.
One thing too, I do want to highlight is in truth, you actually get the best medical care when you're in a clinical trial because we are watching things so closely. We're watching your blood work. We're watching how your heart works. We're doing all these tests. And there are so many times where we have incidentally caught things for people that have made their lives better, preventing heart attacks, catching abnormalities in the blood. And we connect you back with your physician when we find those things to make sure that you're getting exceptional care. Yeah. So even though there is this incredible selfless, altruistic kind of component to it, it's good to be selfish too. It's good to take care of yourself because you can't take care of others if you're not taking care of yourself. And so I think that's just one more added benefit of the work that we're doing.
I totally agree. Dr. Tiffany, and I'm going to call you Dr. Tiffany because Schwasinger-Schmidt is a lot. Really Thank you so much for being with us. Thank you for doing big things in Huntsville. Folks, go and check out these clinical trials. Like she mentioned, we'll have the website that you can click on and just go check it out and potentially volunteer. There are people like Dr. Tiffany doing so many big things in Huntsville that most of us might miss. So that is why we highlight folks like her, folks with a bigger heart and a bigger purpose than if somebody's a doctor, they can definitely be successful in life and make a great life for themselves. But what's special about her is she's taken that medical training and she's actually using it to make our lives better, to help the next person down the road, which is awesome. Dr. Tiffany, thank you for being here. Thank you everyone for watching and checking out what's happening at UAB. Definitely don't pass the red building and not think about this anymore. So we'll catch you next time on the Big Huntsville Podcast. Have a great day.
Thank you.
Thanks for tuning in to the Big Huntsville Podcast. If you've enjoyed the stories, the laughs, and maybe learned a little something new about our amazing city, remember, Huntsville isn't just a place, it's a community. And we've got some of the best folks around. So if you like today's episode, please don't forget to subscribe and share it with a friend. And if you got a local hero or story you think we should highlight, hit me up. I'd love to hear about it. Until next time, I'm Carl Thomas. Keeping it fun, keeping it real, and always keeping it big here in Huntsville. Catch you later.